I'm Julia Bevan, one of the nurses from Spirit. I'm going to show you how to use your TEE2 meter. So in the box you'll find lots of information about the meter. In the pack you'll get a lancing device, the meter. You'll also get 10 test strips and 10 lancets. If you need some more test strips and lancets, you can get these on prescription from your GP practice. So first of all, if you start off by washing your hands with some nice warm soapy water, and then make sure you dry them properly. I'm going to show you how to use the lancing device. It's best not to use these two fingers on your thumb, so only use these fingers. If you can, if your skin is a bit thin on your little finger, just use your middle fingers and your ring fingers. And we always say to do it at the side of your finger rather than the pads of your finger, just because you've got loads of nerve endings and it can become very sensitive, and over time it can become numb. So if you do it to the sides, it does hurt less as well. This is the lancing pen. So if you twist it off at the grey piece, just remember that it all twists. Now if you pop a lancet in, now these are for single use, so you should change them each time you do a check. If you just carefully twist, pull it upright, try not to bend the needle, and then you'll expose the needle. Just twist the cap back on. The top piece, if you see the numbers, that is the depth of the needle. So the bigger the number, the deeper it goes. So don't start off on number 7. 2 or 3 is normally average. I'll pop it on number 2. Then if you pull it back at the bottom, it will go red in the window. So you can see that it's ready to use. I'll just pop that to the side. The test strips, they're called TEE2, and they just look like this. That's the back of the test strip. That's the front of the test strip. The barcode piece just goes into the bottom of the meter. So if you pop it in, it'll turn itself on automatically and it'll show you a little blood drop flashing. Now you don't need to set the meter up, it will already have the date and time set on when you've got your new meter. So then make sure it's pulled back. We're going to fire it with that little button, so pop it on the side of your finger, fire, and then you can give it a gentle squeeze. If you're not getting enough blood, just turn it up to the depth up to number 3, and so on. If you keep the meter upright, pop it in the blood spot, it'll suck it up. Once it starts counting down, it's had enough blood, and then it'll give you your reading. Once you take the test strip out, the meter will turn itself off. To take the lancing needle out, just unscrew at the grey piece. You can recap it, so just firmly press it into the cap, and then you can just pull the lancet out if it's your own. If it's somebody else's blood and you don't want to touch it, you can use this button at the side to push it out. So if you pull the bottom piece and then just slide the lancet out into the yellow sharps bin and screw it back on. Now the meter does store up to 1,000 tests in the memory. It'll knock the old one off and then it'll just carry on uploading them automatically. To have a look through your past readings, that button is on and off, and then the other 2 buttons to the side are just to look through your past readings. So if you press the downward arrow, that will take you back through all your past readings with the date and time at the bottom. If you go up, it will take you back to the beginning. It will then go on to averages. So you've got 1, 7, 14, 30 and 90 days average. And then just turn the meter off. If you need any batteries, they just go in the back of the meter. Or if you need someone just to go through the meter, you're unsure about something, then just ring this 0800 number and they will post you out batteries the next day for free, or they will talk you through whatever it is you're unsure about. Okay, thank you.